physiotherapist, and today I'd like to talk about a really common knee condition referred to as patellar tendonitis. Essentially, this condition, which is also called jumper's knee, is inflammation of the patellar tendon, and the patellar tendon runs just below the kneecap, right off the insertion point of your patella, and it connects onto a small little bone right off of your tibial called your tibial tuberosity. Now, this is a really common condition for individuals who play sports such as soccer, who run a lot, who do lots of activities that involve directional changes in movements, again, prolonged running or sprinting, in which there's typically, what I find with these individuals is there's actually an overuse of the quadricep muscle. And so what happens with these repetitive exercises or repetitive sports is that patellar tendon gets pulled on a consistent basis because, again, of this overuse of the quadricep muscle, and over time it becomes inflamed. What I notice again with these individuals is they typically are overcompensating for weaknesses in their glutes. There might be some biomechanical factors. Sometimes with these individuals as well, you might find that they're, in terms of how they stand, or their feet are either overpronated, which is kind of flat feet, or oversupinated, which is a very high arch. A lot of times with these individuals as well, what I'll notice is they'll also have very, very tight IT band, which is connective tissue that runs, again, from the hip down towards the knee area, and also a very, very tight psoas or hip flexor muscle. So again, with these individuals, there tends to be an overuse of a lot of the muscles in the front of the hip thigh region. So again, quads, IT band, hip flexor, and an underuse of glutes, so glute max, glute med. And so essentially what's going on is when they're doing these different activities, like running, like soccer, basketball, again, these sports that require significant running, directional changes, where they might be in sort of a squat type position for a prolonged period of time, is, again, there's an overuse of the muscles in the anterior portion, or the front portion of the thigh hip region, and an underuse of the glutes. So from a physiotherapy standpoint, there's several different interventions that can be done to help treat this condition. The first thing, because again this condition tends to be quite irritable, quite sensitive when I see patients come into the clinic with this, and so a lot of times what I'll recommend, just as a temporary crutch, is they do have a patellar tendon brace. And basically what it is, it's just a strap that goes just below the kneecap, and it puts direct pressure on the patellar tendon. And the reason for this is it helps to prevent that force in terms of the pull on that direct insertion point off of the tibial tubercle, as we were talking about before. So it can help, again, just from a short-term perspective, while having to rehab some of these different muscle imbalances, it can help the individual with just day-to-day activities. So again, when I see certain individuals coming in, the condition is so irritable that things such as just sit to stand, regular walking can be painful, prolonged walking, stairs, going up, down stairs, going up and down hills can be quite painful. And so again, just from a short-term perspective, using a brace just as a crutch while we rehab can be helpful. Specific stretches can be helpful with this condition. So again, typically quads, and a combination of quad and hip flexor stretch is really important. As I mentioned previously, a lot of times with these individuals, it's the muscles in the front that are being overused, overworked, and that's what's contributed to this condition. And so again, doing very specific stretches for both those muscles, and also rolling out the IT band can also be very helpful. Putting direct pressure or basically a self-massage directly on the patellar tendon can also help in terms of increasing blood flow, breaking up any scar tissue in the area, and actually making the tendon more pliable. So again, with that particular technique, it can be quite sensitive, so we want to keep that pain level fairly low when doing that technique, but again, it's another intervention that can be helpful. Other passive modalities which can help in terms of swelling, inflammation, and pain are things such as acupuncture, using ultrasound, therapeutic ultrasound, again in terms of increasing blood flow, increasing circulation to the area, breaking up scar tissue, making the area more pliable, helping to reduce any inflammation. And then in terms of, from a strengthening component, working on glute strengthening specifically, so glute max, glute med strengthening, and also making sure that the individual eventually, from a functional standpoint, that this individual is using the muscles appropriately when they're doing things like squats and lunges and weight bearing specific exercises, as well as balancing or plyometrics. So any sort of functional exercise that they're doing, we're going to want to make sure that they're actually activating the proper muscles so that there's not an overuse of, again, all of these anterior muscles that we talked about before. So quads, psoas, as well as your TFL, which is the muscle that connects onto your IT band. And then finally, and again, quite frankly, the most important exercise, which from a research standpoint has been found to give the greatest benefits, are eccentric quadricep exercises or strengthening exercises. So what an eccentric contraction means essentially is strengthening the muscle in a lengthened position. And so with that, it works very similar to when we work with individuals with Achilles tendonitis, in that you want to work that muscle in an eccentric contraction in order to put the tendon essentially in more of a stretched position. This is really important, particularly when there's some scar tissue buildup, which is going to occur when you have inflammation. And then it's also going to be helpful with regards to, again, typically with the actions or the activities that these individuals are doing, that quad muscle is actually in an eccentric contraction when it's painful. So the pushing off directional changes, again, plyometrics. So it's going to be really important to actually work into that. Using pain as your guide, again, it can be quite sensitive. There can be some discomfort initially when doing eccentric quad exercises, but it's going to be really important to work into that, again, using pain as your guide, and also making sure that your form when doing an eccentric contraction is proper. So again, as I talked about before, a lot of times the glute muscles are quite weak with these individuals, and so a lot of times in terms of doing a proper lunge or doing a proper squat, the support, the glute support, the inner abdominal support as well, so pelvic strength support is not there. And so from a biomechanical standpoint, again, there's an overuse of the quads, which is actually leading to this condition in the first place. I hope you found that information helpful, and as always, please leave a comment or concerns below, questions, concerns, and again, I thank you for watching the video, and have a great day.